The highest level of education is a doctoral or doctorate degree. Most students are familiar with a doctorate in medicine or a doctorate in osteopathic medicine, which means you'd be attending medical school. If you are interested in a career in medicine and working with patients struggling with mental illness, you may consider becoming a psychiatrist. Psychiatrists diagnose mental illnesses, educate the patient and family about mental illnesses, and prescribe medications to treat mental illness. The ability to prescribe medication is one of the primary differences between a psychiatrist and a psychologist. Becoming a psychiatrist typically requires 8 full years of training after your bachelor's degree, 4 years in medical school, and 4 years of residency. They are in high demand and they usually make over $100,000 per year with an average salary of about $200,000 per year. Now let me talk about the PhD option, or a doctorate in philosophy in the field of psychology. This is an excellent option if you're interested in doing research, therapy, psychological assessment, teaching at the college level, supervision, consulting, or any combination of those things. In general, completing a PhD in psychology takes about 4 to 6 years. A lot of schools will waive your tuition fees and pay you a small monthly stipend, since you'd be working part-time as a teaching or research assistant. After earning your PhD, and depending on what part of the country you work in, psychologists typically make between $70,000 to $120,000 per year. There are 3 main types of PhD options in the field of psychology: clinical psychology, counseling psychology, and experimental psychology. Both the clinical and counseling psychology PhD programs allow you to do therapy as long as you are licensed in the state where you practice. Getting licensed usually requires a 1-year internship and a 1-year postdoc, as well as passing several state licensing exams. Traditionally, the difference between clinical psychology and counseling psychology was that the field of clinical psychology was meant to address severe mental illness. In contrast, the field of counseling psychology addressed normal people with normal problems. That would be things such as helping people deal with day-to-day stress, career counseling, marital counseling, death and bereavement, and counseling for college students adjusting to their new environment. Over time, however, this distinction has become less important. There are many clinical psychologists who do counseling type of work, and there are counseling psychologists who work with patients with severe mental illness. Both types of professionals are called therapists or psychologists, and the general public rarely has a preference for one or the other. If you're interested in either clinical or counseling psychology PhD programs, I highly recommend looking at the individual school to decide what program best fits your needs. Look at the types of classes you'd be taking, the types of practicum experiences you'd have, who would be supervising your clinical work, and most importantly, what kind of research you'd be working on and which professor you want to work with. As a side note, psychologists who work in legal settings like the criminal justice system or the FBI or the U.S. Secret Service are called forensic psychologists. Typical job tasks include doing research on criminal behavior, mental health evaluations, jury selection, criminal profiling, or serving as expert witnesses during criminal trials. You can become a forensic psychologist by getting your doctoral degree in clinical psychology with a focus on legal or forensic psychology. Although you can get a master's degree in forensic psychology, it is often recommended to get your doctoral degree in order to have the most seniority in your job and to operate a private practice. One thing to be aware of is that a PhD in experimental psychology does not allow you to do therapy or counseling. These often include more specific areas of focus, such as social psychology, biological psychology, or behavioral neuroscience, industrial organizational psychology, cognitive psychology, sports psychology, and developmental psychology. This is a great option if you're only interested in doing research or teaching at a university, or a combination of the two. However, I would not recommend applying to experimental psychology graduate programs if you ultimately want to go into counseling or therapy. At this point, you may be thinking that a PhD in psychology sounds great. However, I have to warn you that these programs, especially clinical and counseling psychology PhD programs, are extremely competitive, with average acceptance rates around 5%. This is because most APA-accredited PhD programs accept students based on a matching system. One particular professor might accept one student per year, based on which student seems to be the best fit and the most qualified applicant out of hundreds of applications. Being qualified is more than just a high GPA or having high GRE scores. It's also about your past research and clinical experience, your letters of recommendation, and the skills you'd have to offer. Most of all, they will want to select someone who is a good fit for their research project. This is why it's extremely important to think carefully about which schools you'd like to apply to, and especially which professors you'd want to work with based on the professor's current research. If you want additional information about applying to and getting accepted into PhD programs, a later video in this series has some great advice. Whether you're considering a clinical, counseling, or experimental psychology PhD program, the most important thing you should ask yourself is, am I interested in doing research? That doesn't mean that you must pursue a lifelong career in research. However, you should be interested enough in research that you could see yourself working with a professor for about 4 to 6 years doing research, reading scientific articles, writing papers about your research, and ultimately completing a major research project, culminating in what is called a dissertation. If you hate the thought of doing research, you may consider an alternative training program, such as a doctorate in psychology or a PsyD program. A doctorate in psychology degree is the perfect type of graduate program for people ultimately wanting to be a therapist and who also want a doctoral degree. With a PsyD degree, you can become a licensed clinical psychologist, and you can work in a variety of settings, such as private practice, hospitals, community mental health clinics, private clinics, and more. The salary is competitive with that of a PhD clinical psychologist, usually between $75 to $150 per hour, with salaries ranging between $70,000 to $120,000 per year. Going through a PsyD program typically takes 4 to 6 years plus a 1-year internship. After that, there's additional supervised work to get licensed. Most of your training would be clinical in nature, along with required coursework. There would be little emphasis on doing research. Probably the most appealing thing about a PsyD program is that the acceptance rates are much higher than PhD programs, ranging between 20 to 40%. However, you have to be careful of several things. A lot of PsyD programs are located in for-profit institutions, such as freestanding professional psychology schools. In contrast, PhD programs are usually located within university settings. In other words, not-for-profit institutions. Many PsyD programs charge tuition, which can cost as much as $20,000 to $40,000 per year. PsyD programs may accept as many as 40 to 70 students per year, which means a less desirable faculty-to-student ratio. You would have much larger classes, less one-on-one attention, and your supervisors may not be readily available. Data reveal that the rate of obtaining an accredited pre-doctoral internship that's required for licensure in most states is significantly lower for students coming from PsyD programs, especially unaccredited PsyD programs. This can be as low as 7% for unaccredited PsyD programs and 50% for accredited PsyD programs. This is compared to an acceptance rate of approximately 80% for accredited clinical PhD programs. If you are interested in the PsyD option, my advice is to pick your program carefully and stick with an accredited program that adheres to evidence-based practices. There are high-quality programs available, especially at nonprofit institutions. Last of all, I briefly want to mention the Doctorate in Education with a focus on psychology. This is a degree that allows you to become a school psychologist. School psychologists with their doctoral degree can work in schools and non-school settings, such as private practice. They receive extensive training in clinical assessment. That means a lot of their time is spent administering tests, scoring them, and writing reports. They can work with children, adolescents, parents, and teachers. They can work in areas of special education or do research and teach on topics of educational psychology. Becoming a school psychologist requires 4 to 5 years of school, a 1-year internship, and passing state licensure tests. School psychologists typically make between $70,000 to $80,000 per year.